to discuss today. We want your participation as well. Our head table participation and myself and Dr. Archie is going to conduct the panel discussion on pain management with acupuncture. As you know, whatever the field of medicine you are working, it is guaranteed that you are going to get patients with pain every day. Whether you work in acute care, whether you work in palliative care, whether you work in elderly care, surgical setup, wherever you are working, definitely it is guaranteed that you are going to get patients comes to you and tell that I am having pain and just doctor do something for me. Well, it is fundamental for us to know something about the pain, how we access it, how we manage it, how we manage safely and effectively, and what are the complementary modalities we can use to bring down the patient's pain. I know one main reason most of you are here, that is because all the known methods of pain relief in other medicines are a failure. Not because that acupuncture can do everything, but we are looking for something that we can bring down the patient's pain. And do you know that 65% of the patients, those who are coming to you, not because of any other reason, but because of the pain they are suffering from. So you are here to learn, you are looking for something that we can implement to bring down the patient's pain. So this is the time that acupuncture is mainly indicated. As you know, as far as the physiological effects of acupuncture is concerned, number one effect is the pain relieving effects. There are many physiological effects of acupuncture: pain relieving effect, anesthetic effect, anti-inflammatory effect, tranquilizing effect, sedative effect, psychological effect, motor recovery effect. There are many physiological effects of acupuncture. And number one being the pain relieving effect. So this can be applied as a non-pharmacological mode of treatment to bring down the pain. What has created this pain? For two main objectives. One is to make us a living, and the second is it is a protective mechanism. When you say it is a protective mechanism, it is not simple as that. Because when a woman is having a pain during the labor, there is no protective mechanism in it. Why are we having pain in the migraine? If you remove the pain, there is no disease. Why are we having the pain in phantom limb pain? If you remove the disease, there is no pain. Why are we having the pain in trigeminal neuralgia? Remove the pain, no disease. So when you say it is a protective mechanism, the proportion of the pain must be proportional to it should be directly proportional to the threat to your life. Have you been ever experienced a toothache? There is no threat to your life, but it is miserable. You are feeling like committing suicide. So pain is a puzzle. One day, the God asked from the queen of the pain, what is the pain? The queen of the pain replied, 1 minute pleasure, 9 months pain, little rest and have it again. With that saying, with that joke, I would like to start our discussion. First of all, I would like to show you a video how we are approaching, how we manage the pain with acupuncture. This gentleman had been treated for many years in the conventional drugs with no improvement. Once he came to our acupuncture clinic within few weeks of time by giving needles, and this is what he had to say. We'll go to this testimonial.
Okay.
I'm Sali. My age is 64. I've been taking medicine for the shoulder pain for the last 8 months. During that time, before that, I took medicine for the last 5 months at Kalubovilla. So I was not satisfied, painful. Then after that 5 months, I came here. And now I feel better. And feel better in the sense now about 80% I'm okay. The 20% only still I'm going for treatment every day, and physiotherapy also I'm doing for the last 1 week. Now I feel better. I hope I will be all right another 1 or 2 weeks time. So I pray that I will be okay. And I was given a special needle. It's about 1.5 inches needle. It was given by Dr. Saman. That was very effective. After that I feel more better. Now only another 20% to be cured.
When you first came to the clinic, what was your movement like?
When I came to the clinic, first of all, I couldn't raise my hand. I was able to raise only up to this. Now I can raise up to this much.
Yeah.
And the second part is this side. Also I couldn't raise, lift it. But now it's all right, but it's painful still. Only up to this I can do it, and backward also very difficult. Now a bit all right.
Yeah. Can you try and scratch your back?
Up to this much only I can, because after that only this much I can.
Okay.
And
Can you touch the top of your shoulder like this?
I can turn it like this and all.
Can you raise both your hands in
I
front?
can raise both my hands.
Okay.
And this way also,
Raise it as high as you can.
but only up to this. Only up
A
to
little bit
this.
more is painful.
Yeah, before that I couldn't do that also. Now it's,
Can you touch your shoulder like this?
even I can touch. But it's a bit painful. So I hope I'll be alright.
Okay. Anyway, thank you so much for your time.
And how we can treat for the rotator cuff lesions, the frozen shoulders. I know most of you will have a lot of questions regarding that. So we'll come to you all. Just give me a second. We'll come to you all, right? So I'm going to turn to Dr. Harsha, who's an MBBS doctor, who's practicing acupuncture. Harsha, could you kindly elaborate on us? So how this is working? So what are the scientific theories that they have formulated to show how the acupuncture is working on this type of pain-related conditions?
Thank you, Dr. Saman. So acupuncture mainly has this analgesic effect, as Dr. Saman explained. So it is mainly used for these headaches, migraines, menstrual pains, joint pains, and various radiculopathies, and even phantom pains. We see a lot of these type of cases respond very well to acupuncture. So in our clinic we treat many of these cases and we see very fast results. So as the scientific basis, the needling affects the cerebrospinal fluid concentrations of naturally occurring opioids. So there are certain natural opioids such as dimorphine, endorphin and enkephalins. So dimorphines actually act on the spinal level at the cerebrospinal fluid, and the endorphins act within the brain, cerebrospinal fluid within the brain, and the enkephalin. Certain sports injuries, certain other injuries which are related to musculoskeletal pain will be blocked because of these two opiates. And then dimorphine is a powerful modulator of the visceral pain. So any deep organs or any visceral organs giving deep pain will be blocked because of this. So endorphins, which are called natural morphines, as shown in the slide, when a pain signal transmits from a neuron to the brain, the receptors are there. So these receptors and these signals are also blocked. So it's a complex theory where it also acupuncture can mainly explain according to this gate control theory. So
Those theories are very popular neurological theories which they have formulated to explain how the acupuncture is being working inside the central nervous system. So what Dr. Harsha said, that our perception of pain is being modulated by gate or gates at the central nervous system. Under the normal circumstances, this gate is widely open and the pain impulses can pass through this gate quite easily. But when an acupuncture needle is being given into a specific point, a second set of non-painful impulses are emerges. So the results would be overcrowding or jamming at the gate, causing it to either close. So the results would be either no pain or less pain. There is a inhibition of the pain impulses at that gate. So that is the theory which have been formulated by Ronald and Melsack in 1970s, I remember. And another popular theory is the endorphin theory. As acupuncturists, you may have been experienced the patients, those who keeps on coming to your clinic even after their original problem has been completely dealt with, and they believe acupuncture causes euphoria. There is a significant euphoric effect of acupuncture, mainly because of the endorphins and encephaline. So that is called as the acupuncture addictions. So their original problem is already sorted out, but they keep on coming, doctor, my pain is from your brain stem to your bloodstream once the acupuncture needle is being given and stimulated. Right? So, so those are the scientific theories that they have formulated. Before we are coming to the next slide, I think there is a question from the audience.
I want to know that which group of points you used in the patient which you have shown to us, and what is the rationale of using those points?
Well, actually, we are dividing our acupuncture prescriptions according to the status of the illness. Whether it is an acute case, whether it is a subacute case, whether it is a chronic case. In this case, he has been taking needles almost for about 2 weeks by giving the points, selecting the points according to the 5 needling techniques, which was introduced by Professor Int'l, that is known as a governing point, local point, distal point, influential point, specific point. So after some time, he felt a bit of a response, improvement, but not up to the standard. That is why he told, when I gave that particular needle, that is called a magic needle, Chaco stomach 38, on that particular day, he was able to raise it to a certain extent. But on that particular day, after giving that particular point, after giving a strong stimulation, after the patient feels that particular sensation, what we call acupuncture sensation or dirty, and immediately he was able to move his arm up to this level. So those are called magic calls. The students of the Professor Int'l would have known, would have heard about this particular point. There are a set of points called magic points. Those points has to be inserted and give a strong stimulation until the patient feels dirty. That is a very important phenomena. In acute cases, those points which you are using to treat for acute conditions has to be stimulated until the patient feels dirty. Dirty is a very important neurological phenomena. As you know, it is a combination of numbness, heaviness, soreness, distension, and radiation, one of these sensations along the channel. So that has to be produced. That you are using different techniques, lifting, thrusting, rotating clockwise, anti-clockwise, according to the great law of Cauchy. But basically, remember, if you are to get the results for acute conditions like problems, so it has to be strongly stimulated. So there is another theory. So they believe once a needle is being given to that particular point, when you are using these different techniques, there is a friction against the needle, the metal of the needle, and the walls of the skin. That will generate a galvanic current, and it will send impulses to the higher centers of the brain where the pain is being interpreted. And that was formulated 5,000 years ago. We'll see from this video what they are telling according to the scientific research. They have reproved the dirty phenomena scientifically.
Well, we've made a good start, and we've agreed on what test we're going to use. We'll stick the needle in on a well-known acupuncture point just here. And for the real acupuncture, we'll stick the needle in quite deep and do a brain scan of the volunteer. As a control, we're going to just stick the needle in a short distance and twist it, and then do the brain scan. And so by comparing those two, we ought to be able to see the difference between the real acupuncture and the control. This is a genuine piece of new research. We plan to look deep into the brain during acupuncture to find out, one way or another, whether acupuncture is having a measurable effect on the body. The team are trying to detect the tiniest changes in the brain when the needles are inserted.
Just very slowly. It's wonderful.
3, 2, 1, start.
Finally, the experiment begins.
Let me go.
You're going now.
Scientific way of thinking. And it could completely change the way that we see acupuncture. At last, results day. Now, the results are looking really interesting, but Hugh, maybe you could just summarise the main findings for us really clearly.
First of all, with superficial needling, we get a picture in the brain of this area lighting up, in other words, becoming activated, increased blood flow. And if you look at this brain here, this is the front of the brain here, and this is the back, and we have a cutout there just so you can see inside better what's happening.
That's no surprise. This is just the brain's normal response to the needle being lightly inserted.
What we found with deep needling, if we had de qi, the de qi sensation of a needle, that's the aching sensation, what we picked up was deactivation. Areas of the brain here, further back, where we've coloured that blue.
Acupuncture was having a real effect on the brain, and it was doing something completely unexpected. It was a result that surprised us all. I'm sure scientists will continue to examine acupuncture. After all, huge gaps still remain in our understanding of this ancient medicine. But for me, the results of our experiment do add weight to many of the stories I've heard in my travels. It's been quite a journey for me. I started off pretty skeptical about acupuncture. It just didn't make sense from a scientific point of view. Then I found evidence that it really does work for some kinds of pain. And then the experiment was just hugely exciting to take a step towards understanding what's going on in the brain. So it's been an astonishing time. And I believe that acupuncture still has a lot to teach us.
Right science and training, right? In which we planned our experiment, we insert the needle in the UB60, the point near lateral malleolus. And at the same time we use our sham point. We stimulate the point in our brain. Our whole body is topographically distributed. If we do this, then our hand area in the brain is activated. There is a continuous utilization of the oxygen, and there is a lacuna or vacuum in that particular part of the body. There is no other signals which goes to the brain, and we simply stimulate the UB60 point. If our experiment is failed, then we must get the activation at the lateral malleolus area. But we doesn't found any activation at the lateral malleolus area. But instead of this, we found the activation at the visual associated area, right? So UB60 is working at the visual associated area, and UB67 is working on the visual area. So this is the first research which is carried out by me in India with the scientist Sushil Chandra, scientist G in Mars. Thank you.
In my mind, what are the other points which we mainly use to relieve the pain? So there are a few sets of points. The main point is the HER2, large intestine 4, that is called the great eliminator, that is called the aspirin point of the body. So we have aspirins, we have antihistamines, we have Viagras, acupuncture Viagras. So this is the acupuncture aspirin in our body, one of the major points, which is responsible for the analgesic effect. And Chong Dia was small intestine 18, you find this point here. And Tai Chong liver 3 and Nating stomach 44. Those are the main points which we use to treat for the pain. And as far as chronic pain is concerned, we are paying our attention for the emotional component of the pain. And in that case, we use Shen points like Paihu 220, Shi Shan Chong Extra 6, Shen Man Heart 7, Shen Mai UB 67, and UB 60, Egg 1 pericardium UB 62, Paihu 220, Shi Shan Chong Extra 6, Shen Man Heart 7, Neck 1 pericardium 6, Shen Mai UB 62. So those are the usually it falls into the sedative points category, as we concentrate on the Shen aspect of the patient just to treat for the emotional component of the pain. We are using these sedative points as well, right? So can you, yes, I'll come to you. Can you believe when you are being taken to a hospital, to an emergency unit, now the doctors are using acupuncture to bring down your pain, and this video will demonstrate about that.
Back pain.
Senior most person who is attending this conference regularly since last 30 years, and I am one of the very good friend of Int'l. So I want to add one thing, that there is one point that my doctor have missed, that is small intestine 3, that is for acute low backache. And this I have used many times, and it will give you wonderful results in acute low backache, that is small intestine 3. Thank you.
Problem, it won't work. If it is a muscular problem, it will give you instant. Those are called magic points. Even stomach 38 and GP foot lynchy, GP 41 is also being used for frozen shoulder pain or this condition. So we'll have a look this video how this acupuncture is being used in the acute conditions in the emergency section of the hospital.
Back pain, nausea, all common conditions that doctors say can land people in the emergency room. But one local hospital is offering patients a new option to eliminate pain. Mary Stoker-Smith explains it's based on a practice that's thousands of years old.
It's a place where
the typical day is that nothing's typical.
And inside,
the wounds appear to be superficial.
There's some days where we see more minor cases, and some days where we have people that need full resuscitation.
No matter the day when someone walks in,
If anybody presents to the emergency department with what they consider an emergent condition, we will evaluate and treat them.
But at the Aurora West Dallas Emergency Department, traditional treatment is being turned upside down with traditional Chinese medicine.
Acupuncture has been around for thousands of years.
It's been less than 2 years this ER has offered the alternative.
I was skeptical. I wasn't sure. I knew of the practice, but I didn't know how it would work.
It's a natural, non-pharmacological way to reduce pain.
That means no medicine at all.
This one is one of the most common relaxing points that we use here.
An option emergency room doctors want for their patients.
We have a real problem with narcotic opiate abuse and addiction in this country.
We are currently in the throes of a opioid crisis.
And it's just great to have an alternative to prescribing narcotics for some of these conditions.
Conditions that are all too familiar in the ER.
Pain is a very common presentation to the emergency department.
I was just nauseous and pain head to toe and pretty much in fetal position.
Barbara Orban opted for needles over narcotics during her hospital visit.
And I was like, absolutely, whatever it takes to get rid of this pain.
Even she admits.
I was like, what? You can't possibly tell me that sticking needles in my body is going to take away this pain that I have.
Hours later,
they hadn't given me anything other than fluids and the acupuncture. And I walked out 2 hours later, it was unbelievable. Unbelievable.
Doctors know acupuncture won't fix everything.
There are some cases where it's appropriate that we do use opiates or narcotics to treat pain.
But are glad to have an atypical option.
The benefits are many.
In a place where nothing is typical. Mary Stoker-Smith, Fox 6 News.
Aurora says so far, more than half the patients offered the alternative have tried it.
I was in an accident a few years ago and was treated with acupuncture. I'm a firm believer in it. It does amazing results, has amazing results. So yeah.
Interesting.
Good for them.
Okay, so sorry, maybe you can understand a little bit. Painful, lots of people can cure that. Here, we want to show our hospitality to show you. Maybe we should prepare a better body before we get healed. Get to be painful. We don't want to suffer from the painful after we got the problem. So this teacher wants to show us when we are healthy, how can we keep it longer? And so let's practice. You can practice at home if you want. That's very easy. And if you can build this habit at home, you will no time. You don't need to see doctors to cure you in the hospital. That's what I really want. It's also Chinese philosophy about the medicine. Okay, now, thank you for also give us a chance to show you. It's lucky for both of us.
Thank you. All the students, here they go, please.